Can bladder stones grow large without symptoms? Imagine having a small stone in your bladder that quietly grows over time without causing any noticeable issues. Yes, bladder stones can become quite large without showing obvious symptoms, especially in the early stages. Many stones develop gradually and do not block urine flow or irritate the bladder lining enough to cause pain or discomfort right away. This means they can grow quite big without alerting you to their presence. Bladder stones often form when the bladder doesn't empty completely. This incomplete emptying leads to concentrated urine, which promotes mineral crystal formation. Conditions like prostate enlargement, nerve damage affecting bladder control, infections, or even foreign objects in the bladder can contribute to the development of stones. Because these underlying issues may not cause obvious symptoms initially, the stones can quietly increase in size without causing discomfort. As bladder stones grow larger, they are more likely to cause symptoms. These can include feeling a frequent or urgent need to urinate, pain or pressure in the lower abdomen or pelvis, blood in the urine which might appear at the end of urination, a weak or interrupted urine stream, or painful urination. Sometimes, recurrent urinary tract infections can be a sign of larger stones irritating the bladder lining. In severe cases, a large stone might block urine flow entirely, leading to urinary retention. However, some people with large bladder stones might only notice subtle signs, like repeated urinary infections without significant pain. This means that even big stones can sometimes go unnoticed until they cause complications or are found during routine imaging or cystoscopy. It is important to remember that bladder stones are not cancerous, but they can cause ongoing irritation and inflammation of the bladder lining. This chronic irritation can increase the risk of infections and, in rare cases, lead to changes in the bladder tissue that requiring medical attention. In summary, bladder stones can indeed grow large without symptoms, especially if they do not obstruct urine or irritate the bladder early on. Symptoms usually appear as the stones enlarge or cause complications, but some large stones remain just silent or cause only minor signs like recurrent urinary infections. Underlying conditions that prevent complete bladder emptying are key factors in stone formation and growth. Regular checkups are important if you have risk factors or urinary symptoms to catch stones early and protect your bladder health. If you suspect you might have bladder stones or experience urinary issues, consulting a healthcare professional for proper imaging and evaluation is the best step to ensure your bladder stays healthy.